Welcome back to Health Insights Plus. Today, we're tackling a crucial but often ignored topic, kidney disease. Your kidneys quietly filter your blood and balance fluids, but when they falter, the warning signs are easy to miss. Subtle symptoms like fatigue or swelling can be the first hints of trouble. Early detection is key. Catching kidney disease early can prevent serious complications. In this video, we'll break down 8 silent signs your kidneys might be struggling and why you shouldn't ignore them. Let's dive in and learn how to listen to what your kidneys are telling you. One of the earliest and most noticeable signs that something might be wrong with your kidneys is a change in your urination habits. While it's easy to overlook, paying attention to how often you go, how your urine looks, and how it feels when you urinate can provide crucial clues about your kidney health. For example, if you notice that your urine is persistently foamy or bubbly, this isn't something to ignore. Foamy urine can be a sign that protein is leaking into your urine, which is one of the earliest markers of kidney damage. Healthy kidneys usually prevent protein from escaping into the urine, so this change can be a red flag that your kidneys are struggling to filter properly. Another important sign is a change in how often you need to urinate, especially at night. If you find yourself waking up multiple times to use the bathroom, or if you suddenly notice you're going much less than usual, these are both potential warning signs. Both increased and decreased urination can signal that your kidneys aren't functioning as they should. Perhaps the most alarming change is seeing blood in your urine. Even a small amount of blood can be a serious warning sign that should never be ignored. Blood in the urine can indicate kidney disease, infection, or even more serious conditions like kidney stones or tumors. If you experience pain, burning, or discomfort while urinating, this could be a sign of a urinary tract infection. If left untreated, these infections can travel up to the kidneys and cause even more damage. It's important to take these symptoms seriously and seek help early. Remember, these changes aren't just minor inconveniences or things to brush off. They're your body's way of signaling that something could be wrong beneath the surface. Ignoring them can allow problems to get worse, making treatment more difficult down the line. If you notice any of these symptoms, persistent changes in urination, blood in your urine, or pain when you go, don't hesitate to reach out to a healthcare professional. Early detection and intervention can make a huge difference in protecting your kidney health. Taking action early, even if you're unsure, can help prevent more serious complications and give you peace of mind. Your kidneys are vital organs, and looking after them starts with listening to your body's signals. Now, let's move on to the next important sign to watch for. Next up is swelling, also known as edema. This is one of the most common and visible signs that something may be wrong with your kidneys. Edema happens when your body starts to retain more fluid than it should, and this extra fluid leaks out into the tissues under your skin, causing them to puff up and look swollen. When your kidneys can't remove excess fluid and sodium from your blood, that fluid builds up in your tissues. This is often a result of the kidneys not filtering blood efficiently, which can be due to chronic kidney disease or other underlying health problems. The sodium and water that should be leaving your body instead get trapped, leading to noticeable swelling. Swelling usually starts in your feet, ankles, and legs because gravity pulls fluid down to the lowest parts of your body. But it doesn't stop there. You might also notice puffiness in your hands or around your eyes, especially when you first wake up in the morning. Sometimes, the swelling can even spread to your abdomen. Pay attention to subtle clues, like your socks leaving deep lasting marks on your legs, or shoes that suddenly feel too tight by the end of the day. These are early warning signs that your body is holding onto more fluid than it should. Puffy eyes in the morning can be a sign that your kidneys are leaking protein into your urine, which is another indicator of kidney trouble. This protein loss causes fluid to accumulate around your eyes, making them look swollen or puffy. Remember, this isn't just a cosmetic issue. Fluid overload puts extra strain on your heart and lungs, making it harder for them to function properly. Over time, this can lead to serious complications like high blood pressure, shortness of breath, or even heart failure. If you notice persistent swelling that doesn't go away after resting or elevating your legs, it's important to get your kidneys checked by a healthcare professional. Early detection can make a big difference in managing kidney disease. Don't just brush it off as tired feet or a long day. Swelling is your body's way of telling you that something deeper might be going on. Always listen to your body's signals. Now let's look at another silent sign that could point to kidney problems. Feeling constantly exhausted? This deep fatigue isn't just about a busy life. Damaged kidneys produce less of the hormone that helps make red blood cells, leading to anemia. With fewer red blood cells, your body and brain get less oxygen, making you feel weak and drained. This tiredness doesn't go away with rest and can impact your daily life. If you're unusually fatigued, especially with other symptoms, get your kidneys checked. A simple blood test can reveal the cause. Don't ignore persistent exhaustion. Nausea, vomiting, and loss of appetite are classic signs of kidney trouble. When kidneys can't filter waste, toxins like urea build up, irritating your stomach and changing your sense of taste. You might notice a metallic taste or ammonia breath, and food may seem unappealing. This can lead to weight loss and malnutrition, making you feel even weaker. If you're constantly queasy or losing your appetite without reason, it's time to see a doctor. These symptoms mean waste is building up in your blood. Don't dismiss them as just a stomach bug. Persistent dry, itchy skin can be a sign your kidneys aren't balancing minerals properly. High phosphorus levels and toxin buildup can cause relentless itching, often worse at night. Scratching may lead to sores and infections. This isn't just dry skin, it's a sign of internal imbalance. If moisturizing doesn't help and the itch is constant, consider your kidney health. Itching, especially with other symptoms, deserves medical attention. Let's move on to another warning sign. Have you ever found yourself struggling to catch your breath after doing something as simple as climbing a few stairs, walking across a room, or even just getting up from a chair? Shortness of breath from everyday activities can be alarming, especially if it's new or getting worse over time. While many people might think of heart or lung problems first, kidney disease is another important cause that's often overlooked. If you're experiencing breathlessness, it's crucial to consider your kidney health. When your kidneys aren't working properly, they can't remove extra fluid from your body. This fluid can build up and eventually reach your lungs, making it difficult to breathe. You might notice it's especially hard to catch your breath when you're lying down, or you may need to prop yourself up with extra pillows just to sleep comfortably. This condition, known as pulmonary edema, can feel like you're suffocating or drowning. It's a frightening experience that can come on suddenly or worsen gradually, and it's a sign that your body is struggling to cope with excess fluid. But that's not the only way kidney disease can affect your breathing. Damaged kidneys can also lead to anemia, which means your blood doesn't carry enough oxygen. With less oxygen reaching your muscles and organs, you may feel tired, weak, and out of breath, even after minimal activity. If you find yourself waking up suddenly at night, gasping for air, or needing to sleep propped up on several pillows, these are serious warning signs. Don't ignore them. Your body is telling you something important. Shortness of breath related to kidney problems can quickly become a medical emergency. If you or someone you know is experiencing severe difficulty breathing, don't wait. Call for help or go to the emergency room right away. Remember, your lungs and heart are closely connected to your kidneys. When your kidneys are in trouble, your whole body can be at risk. Protecting your kidney health is essential for your overall well-being. Next, let's talk about another important sign of kidney disease: high blood pressure and why it matters for your health. High blood pressure and kidney disease are closely linked. Damaged kidneys can't regulate fluid and salt, raising your blood pressure. They also control hormones that affect blood vessel constriction. If your blood pressure suddenly spikes or becomes hard to control, your kidneys could be the culprit. High blood pressure often has no symptoms but silently damages your organs. Regular checks are vital. Don't skip them. If you have hypertension, ask your doctor about your kidney health. Managing blood pressure protects your kidneys and your heart. Now let's discuss how kidney issues affect your mind. Trouble focusing, dizziness, or brain fog can be signs of kidney disease. Anemia means less oxygen to your brain, making it hard to think clearly. Toxin buildup can also affect your nervous system, causing confusion or memory problems. These symptoms are easy to blame on stress, but they may signal something deeper. If you're experiencing persistent brain fog or dizziness, get checked. Your brain needs healthy kidneys to function at its best. Let's wrap up with what you can do next. We've covered 8 silent signs of kidney disease. Awareness is your first line of defense. Don't ignore these symptoms. This video is for education, not a substitute for medical advice. If these signs sound familiar, see your doctor for simple blood and urine tests. Early detection can slow or prevent serious kidney problems. Take charge, manage your blood pressure, eat well, exercise, and get regular checkups. Your health is in your hands. Thanks for watching Health Insights. Plus, stay informed and stay healthy.